help us with the RT44 clinical final. Nina, you have Betty White. She's a 46-year-old female, 5'6", 325 pounds, who was involved in a motor vehicle accident. No past medical history. Had a head injury due to contact with a tree. She's now febrile with a Glasgow Coma scale of 5, a heart rate of 118, respiratory rate of 5, and breast sounds reveal inspiratory crackles and bilateral lower lobes. An ABG is drawn, and the following result is reported. pH is 7.18, PaCO2 is 62, PaO2 of 58, bicarb of 24. Can you please interpret the blood gas given above?
Yes, it's uncompensated respiratory acidosis with moderate hypoxemia.
Okay, thank you. State the most likely explanation for the respiratory assessment noted above.
Yes, since she was involved in a motor vehicle accident, head trauma would be suspected here. Her level of consciousness would be altered. Her Glasgow Coma scale is a 5, which is really low, and also her respiratory rate is 5, also very low.
Okay, so can you suggest the most appropriate treatment for the patient at the time and outline an initial plan?
Yes, of course. So the treatment would be to intubate this patient and mechanically ventilate them. I would do this because of her Glasgow Coma scale being at 5, so very low, and also her ABG values are she's very acidotic, and also we need to do this to protect her airway because she's not able to do so on her own.
Okay.
And once we do get her set up and intubated, I would also put her in a very quiet room, use suction very judiciously, and maintain her ICP levels, monitor them as well.
Okay, and at this time, can you go ahead and set the vent settings based on suggested guidelines in the patient's history?
Yes. And the vent settings that I have set up here are her patient is in volume control with tidal volume is 450 based on 5 to 8 milliliters per kilogram. Her respiratory rate is 15. Her PEEP is 5 and FiO2 is 100%.
Okay, and then so go ahead and do a vent check and record your alarms. Okay, so a couple of days later, you're taking care of Betty White, and the patient's on the following settings. ACVC with a rate of 22, tidal volume of 750, PEEP of 5, FiO2 is 60%. Her vital signs are a heart rate of 148, blood pressure is 78 over 41, a SAT of 85%, and you have high PIP and low tidal volume alarms going off.
I would
So, can you go ahead and suggest therapeutic and diagnostic procedures to determine and treat the cause of this patient's deterioration?
Yes, I would come into the patient's room and immediately take a quick examination of my patient and listen to their breath sounds.
Okay, so breath sounds reveal that absent breath sounds on the right side.
Okay, I would pull back the intertracheal tube just a little bit and continue to auscultate.
Okay, and what do you want to do about the high pressure and low tidal volume alarms?
I would change the mode to pressure control.
Okay.
And increase the FiO2 to 100%.
Okay. Okay, so 10 days later, you're taking care of Betty White, and the patient's on the following settings. Spontaneous mode, pressure support is 10, PEEP is 5, FiO2 is 25%. Vital signs are a respiratory rate of 14, heart rate of 78, blood pressure is 125 over 70, and a SAT of 97%. So please provide key lab values and related tests that you'll use to determine the next step of care for this patient.
I would begin with an ABG, a chest x-ray, breath sounds, of course, their patient's ability to generate a cough, and her secretions level, see if she's managing those.
Okay, and then provide all tests related to the weaning process.
All right, the RSBI, I would do an RSBI test with her, vital capacity, and the NIF and MIP test.
Okay. So the patient's now been extubated and is on a 2-liter nasal cannula, and upon respiratory evaluation, you note the patient's work of breathing has increased and breath sounds reveal stridor. Vital signs are as follows: heart rate is 98, respiratory rate of 21, SAT of 93%. What would you recommend for this patient at this time?
A unit dose of racemic epinephrine followed by a cool aerosol mist.
Okay, good.